Good morning, I'm Dr. Priyesh, medical gastroenterologist and hepatologist, and today we are here to discuss about carcinoma colon. What basically is carcinoma colon? Obviously cancer of the colon. So what part of the intestines are we looking at? So if you see the food pipe or the intestinal systems, this is the food pipe. From here the stomach starts, the small intestine and then the large intestine. Any tumor here in the large intestine is defined as a carcinoma colon or cancerous colon. So who are at risk of developing a cancerous colon? Elderly people, age more than 50 years of age, somebody who has recurrent abdominal symptoms in the form of altered bowel habits, recurrent diarrhea and altered with constipation, significant involuntary weight loss, a family history of colonic cancer, and obviously if there is some history of any GI ulcerative colitis or any GI Crohn's disease in the past. So these are the patients who are advised for surveillance, that is in screening tests for detecting early lesions. And the reason being, if the lesions are detected early, there is a definitive treatment and very successful. Almost more than 95% patients get cured of a colonic cancer. The only caveat is that it has to be diagnosed early on so that it does not spread to the outside organs, and that's why treatment will be possible. So how do we detect a patient with colonic cancer? So there are three basic tests. Two are non-invasive, one is an invasive test. So non-invasive test includes, one is a basic stool local blood test. So stool local blood test basically says that there is some sort of a bleeding from the stools. Now this is not the whole and the be all of the test. There might be false positives, there might be false negatives. But obviously if the stool local blood test is positive, then we need to go for a further evaluation. Second test is a blood test which is a CEA or a carcinoembryonic antigen. So this is a tumor marker. Again, this is a very good specificity, but we are not waiting for the tumor marker to be positive. And the third thing would be to do a simple test, would be an invasive test, is a colonoscopy. A colonoscopy is the one where we put in a scope from the anal area and visualize the entire length of the large intestine, that is a colon, which is real time. And even as small as less than 1 centimeter lesions can be easily picked up in a well prepared colonoscopy from an experienced center for sure. And then we take biopsies if there is any lesion, and depending on the specimen, the findings comes and we take it from there how it works. So in Western countries, it is compulsory as a part of screening surveillance for anyone who is more than age of 50 years to undergo a colonoscopy. And then there are certain guidelines which say that you have to repeat a colonoscopy every 5 years.